Now let's talk about B-complex. B-complex is a combination of B vitamins that are important for our body. It is used to treat or prevent vitamin deficiency caused by poor diet, certain illnesses, alcoholism, or during pregnancy. B vitamins are important building blocks of the body and help keep you in good health. B vitamins in B-complex include thiamine, riboflavin, niacin/niacinamide, vitamin B6, vitamin B12, folic acid, and pantothenic acid. Some brands of B vitamins also contain ingredients such as vitamin C, vitamin E, biotin, or zinc. It's best to consult your doctor or pharmacist if you have any questions about the ingredients in your specific brand of B-complex. For daily dosage, it is recommended to follow the instructions on the label or as directed by your doctor. B-complex is usually taken with food to help with absorption. It can be taken at any time of the day, but some people find it best to take it in the morning to kickstart their day with a nutrient boost. Remember to consult with your healthcare provider before starting any new supplement routine. The recommended dosage for B-complex is to take it by mouth, usually once daily or as directed. It's important to follow all directions on the product package. If you have any questions, it's best to ask your doctor or pharmacist for guidance. If you are taking a brand that contains vitamin C, make sure to take this medication with a full glass of water, 8 ounces/240 milliliters, unless directed otherwise by your doctor. For chewable tablets, it's important to chew the tablet thoroughly before swallowing. If you are taking extended-release capsules, it's crucial to swallow them whole and not crush or chew them to avoid the risk of increased side effects. The same goes for extended-release tablets. If you are taking a liquid product, it's necessary to use a medication measuring device to carefully measure the dose. Don't use a household spoon. Some liquid products need to be shaken before each dose. Additionally, some products that contain vitamin B12 need to be placed under the tongue and held there before swallowing. It's important to follow the label directions carefully to get the most benefit from the medication. To get the most benefit from B-complex, it's essential to take it regularly at the same time each day. Some people may experience mild upset stomach or flushing when taking B-complex, but these effects are usually temporary and may go away as your body gets used to the product. If these symptoms persist or worsen, it's important to consult your doctor or pharmacist. Your doctor has likely prescribed B-complex because they believe the benefits outweigh the risks of potential side effects. Most people who use this medication do not experience serious side effects. While it's rare, a severe allergic reaction to B-complex can occur. Seek medical attention immediately if you notice symptoms such as rash, swelling of the face or throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of all possible side effects, so if you experience any other symptoms not mentioned here, be sure to contact your doctor or pharmacist. As for the daily dosage and timing, it's best to follow your doctor's instructions. B-complex is generally taken with food to prevent stomach upset. Be sure to talk to your healthcare provider about the most suitable dosage and timing for your specific needs. Before taking B-complex, make sure to inform your doctor or pharmacist about any allergies you may have or if you have certain health conditions such as diabetes, liver problems, or vitamin B12 deficiency. If you have phenylketonuria, PKU, or need to restrict your intake of aspartame, consult your doctor or pharmacist before using the chewable tablets or liquid products. Also, if you have diabetes, alcohol dependence, or liver disease, be cautious when using the liquid forms of this product due to the sugar and/or alcohol content. It's important to discuss all the products you use with your doctor or dentist before having surgery. If you are pregnant or breastfeeding, consult your doctor or pharmacist before using this medication to ensure it is safe for you and your baby. When taking B-complex, it's important to be aware of potential drug interactions. This means that B-complex may interact with other medications or supplements, which could change how they work or increase the risk of serious side effects. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with B-complex include altretamine, cisplatin, certain antibiotics, such as chloramphenicol, certain anti-seizure drugs, such as phenytoin, levodopa, and other vitamin/nutritional supplements. Additionally, B-complex may interfere with certain lab tests, potentially causing false results. It's crucial to inform lab personnel and all your doctors that you are taking B-complex before undergoing any lab tests. Remember, it's important to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much B-complex and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. Make sure to keep up with all your medical and lab appointments. It's important to note that B-complex should not be used as a replacement for a balanced diet. It's best to get your vitamins from nutritious foods. B vitamins can be naturally found in leafy greens, vegetables, meat, fish, poultry, and enriched breads and cereals. If you forget to take your B-complex supplement at the scheduled time, take it as soon as you remember. If it's close to the time for your next dose, it's okay to skip the missed dose. Just take your next dose at the regular time. Do not take a double dose to make up for the missed one. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. It's important to keep all medications out of reach of children and pets. Also, do not flush medications down the toilet or pour them into a drain unless specifically instructed. When the product is expired or no longer needed, make sure to dispose of it properly by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.